Good morning. Once again, Gord Hussey. It's 4:47 a.m. on the 5th of November, and I wanted to do a very quick video that has only just now come to my attention. It's based on an article that was published to Canada's National Post newspaper. I've linked it below. The headline is, "Child Hospitalizations Are Spiking. Did COVID lockdowns create immunity debt?" And then the subtitle, "Hospitals are reporting never before seen surges in children with severe viral infections that are pushing critical care beyond capacity." I'll read just a bit. "A virus that infects and clogs a baby's airways is running rampant. An Ottawa hospital where parents have camped out with sick kids in emergency for up to 20 hours has made the gut punch decision to cancel some elective surgeries. In Montreal, doctors have likened the situation in their pediatric ER to a horror film, not knowing what lurks around the corner. Anyone with young children will quickly agree that our kids seem to be getting more sick and sick more often than in the past," said Rodney Russell, a professor of immunology and virology at Memorial University in Newfoundland. Wonder if I know this guy. I know a Rodney Russell. "An unseasonably early crush of respiratory viral infections has once again raised the specter of an immunity debt, a concept described by some as an unintended boomerang effect of distancing, masking, and other COVID containment measures used to slow SARS-CoV-2. This idea is that children having been kept away from bacteria, germs, pathogens for so long that their immune system has been weakened. It needs constant contact with germs, viruses, pathogens to strengthen itself. And I'm not going to speak to that, but I am going to speak to something I read in May of 2020, and it was published to Canada's CBC News out of a New Brunswick affiliate. And the article said that use of masks during COVID-19, not always the answer, says epidemiologist. And they quoted a professor of epidemiology with the University of Toronto, an infection control epidemiologist by the name of Dr. Colin Furness. And he was highlighting the dangers of masking. Remember, this is May of 2020 when I read this. And at that time, I was undecided with respect to masking. I was reading everything I could on the subject. And it made a certain degree of intuitive sense that you would think that putting a mask on would offer some protection. But he made the point, and this opened up for me. This was the beginning of me going in and reading up voracious amounts on this topic. And in the article, he said, the worst thing we can do, the worst is wearing one for too long, noting that masks can collect bacteria and other viruses. Furness said he wonders why this information isn't being shared when there's evidence about it. He quoted a study in a UK medical journal, that's the British Medical Journal. I've linked this article and the British Medical Journal study below. He said a study in a British medical journal showed healthcare workers who wore cloth masks while working were 13 times more likely to get a respiratory illness when compared to the standard practice of only wearing a mask when necessary. And then he had this quote, "This shouldn't surprise us. A mask, you're breathing on it all day long, creating all this wonderful space for bacteria to multiply. Once they get to a certain quantity, you start inhaling them." So my open and obvious question is, I see kids in masks every day, parents with their masks on, and they're masking their children. And I know that in my youngest, in his classroom, there are 2 or 3 students who wear masks on a daily basis. And kids are in school for 6 hours or so per day. In my area, school starts about 8:15, ends at 2:35. It's a 6-hour day. And you've heard me in previous videos, I call them germ rags, disease rags. This is why. I haven't spoken of this for a while, not citing the specific science behind it, but it is backed by science. The British Medical Journal published a study done by an Australian team. They went into a healthcare setting, and the healthcare workers would either wear a medical mask, and I've shown you before, that type with the little folds in it. So they would wear either one of these or a cloth mask for 4+ hours a day over a 4-week period. You can read about it below. That's the BMJ, British Medical Journal link, peer-reviewed science. Wearing these masks for 4+ hours a day. And the general population, a certain percentage, a certain number of people in the general population will develop respiratory viruses. It happens, respiratory infections. They'll get infected with the virus and get sick. And that happens, masking or no masking. That's referred to as the background rate, the normal rate. I don't know what the numbers are. Maybe it'd be 1 in 1,000. We'll just use that as a benchmark, a hypothetical benchmark. So in the general population, in my hypothetical example, 1 in 1,000 people would develop a respiratory infection. If people are wearing masks, they increase that risk, and now it becomes 2 in 1,000. And cloth masks were even worse, as cited by Dr. Furness in that CBC News article, 13 times, 1,300% increased risk. So you have a 1 in 1,000 chance of developing a respiratory infection without masking. That's a hypothetical based on a hypothetical background rate of 1 in 1,000. Pardon me, my mouth is incredibly dry. So you got a 1 in 1,000 chance of developing a respiratory infection as a hypothetical background rate. So if you put on a cloth mask, now you've doubled that risk. Now your risk is 2 in 1,000. And if you put on a cloth mask, now your risk goes up 1,300%. So from 1 in 1,000 to 2 in 1,000 to 13. And I have to question whether masking, because no one wears them on top of that, no one wears them properly. In this article, Dr. Furness suggests only wearing a mask for 2 hours at a time, and if it's cloth, to boil it in between, because some bacteria is drug resistant and you need to kill it. And so boil the mask. Of course, boiling the mask creates a problem that masks have holes in them. That's why we can breathe through them. If they weren't permeable, if they didn't have holes, we wouldn't be able to breathe. And so SARS-CoV-2, the virus, is said to be less than a micron in size. And every study I read, such as one at Duke University, did one early on. And most cloth masks have holes in them that are 5 microns or larger. So basically it becomes like the analogy being using a shopping cart to transport sand. So I will urge anyone watching this, if you know of parents who are masking their children, share this with them. Share my video, share the links to more importantly, the links to the articles, because I'm nobody. I'm not an infection control epidemiologist. I'm quoting one. I do not publish studies to the British Medical Journal, peer-reviewed science. I am quoting peer-reviewed science published to the British Medical Journal. The fact is, I know that kids are getting sick like crazy. I know the absentee rate at my young guy's school. In September of 2020, I had to battle to have my guy not masked. And I won that battle in September of 2020, by going to his teacher, and I provided this information to her. I said, I'm not anti-mask and I'm not anti-science. I'm pro-science. I'm pro the process. And this is what the science is saying. It's saying that masks can be dangerous. And adults don't wear masks properly. How can you expect children to wear them and handle them properly? I mean, people treat masks like they're car keys or a pair of fuzzy dice hanging from their rearview mirror. That's how ignorant our population is. So, I mean, ultimately, the goal is do no harm or at least reduce harm. And it strikes me that all we're doing is increasing harm, especially to children who need adults advocating on their behalf because they can't do it themselves. And stop scaring your kids into thinking they're killing grandma. Let kids be kids. And anyway, shortest video I've probably ever done. Good night, good morning, whatever it is.